sniffing balloons. Well, that's the new form of drug abuse, and that's according to the Narcotics Control Authority. It is worrying, and they are worried about how young men and women are resorting to this, endangering their health. Let's engage Dr. Olivia Ejikunwa Boateng. She is Director of the Head of Tobacco and Substance Abuse at the Directorate of Food and Drugs Authority. Thank you so much for your time here on Newstex. Let's get into this. Sniffing balloons, how did this become a trend?
Thank you very much for having us, and good morning to your cherished viewers. So just like you have said, it's a global phenomenon that we have observed, particularly with our young people, because nitrous oxide, which is also commonly called laughing gas, has the potential of inducing euphoria or laughter at certain concentrations. So we actually, in our monitoring, nighttime monitoring to social events, to pubs and nightclubs, also realized this phenomenon among the youth, and then have started putting in measures to educate them on the harmful effects of the recreational use of nitrous oxide, because it has illicit uses. It's actually used in the food industry as a preservative. During baking, it's used in whipping cream. It's used as a propellant. What you normally would have in a package of Katia burger, when you pack fit the gas that comes out. And it's used for ripening. It's used really in the food industry for has a lot of uses. And it has local and anesthetic and analgesic properties. Because of that, it is also used in dentistry and sometimes in surgery. Then in the automobile industry, I think is used as a fuel enhancer. So there are licit uses for it. But these non-licit uses is the recreational. That's it's a global phenomenon that the youth now are resorting to inhaling the gas from an inflated balloon just to give them euphoria and then to make them giggle and then make them laugh.
Interesting. How does this even work in the first place? An inflated balloon. Explain that for me so that our audience understand how it works.
Yes, an inflated balloon, or sometimes also from a whipped cream dispenser or a medical grade dispenser. They inhale the contents of the nitrous oxide, and per the mode of its action, it will act on your nervous system, your GIT system, other systems, and you would realize that it would induce what we call lightedness, or you get a high, or you get euphoria, become very, very happy, and then you start giggling. So basically, that's the form that they would rather, instead of getting a high on other substances, this is the new trend that they are using.
What are the health implications?
Yes. So I was going to that. There are serious health implications. The recreational uses or the illicit uses, it actually lowers your blood pressure. There are fainting spells that you may have. You may even become unconscious. It causes heart attack. It also has mental health effects. It causes a level of addiction, so that when they start using it at a concentration that you get a high, because you develop tolerance, you'd keep using it till you'd have to be using large doses, and then you'd get addicted to it. And when you do, then you would require psychosocial support or professional help to be able to stop. So it has a lot of health implications and even long-term effects.
How do you propose we stem this tide?
What we've started doing, we started this over a year ago, is to aggressively educate, particularly the youth, on the harmful effects of recreational use of nitrous oxide. And this we've done nationwide. We actually did a baseline in all the other regions to find out the state of abuse. It is predominantly an Accra and Kumasi situation. Most of the regions don't even know about it. So we quickly have to step up so that normally these trends are on social media. So we quickly had to engage people in the schools, the youth in the schools. We go to public transport terminals, we go to markets, we are having debates, and we have added this to the routine public education that we do. We've also had other professional bodies support us. Ghana Medical Association actually also issued a press release for the strict adherence to its use in the professional setting under strict supervision. Then, because I said it's licit, we've had people register it for the food grade. So we've instituted measures to control it. The people we've issued permits to bring, you would have to report on your on your utilization reports where you take it, where it's going to be used for, and we also do routine monitoring, announced and unannounced, to confirm that particularly where you said it's going to be used for, that is where it's being used for. So we are trying to ensure a safe, legitimate supply chain so that it doesn't find its way into illicit use. Aside that, EPA also authorizes the industrial uses. So we are collaborating with them so that they will also bring some restrictions. We are trying in all this to control what comes into the country for the illicit users to not to fuel the illicit users.
Thank you, Dr. Olivia Boateng, for sharing that information with us. We'll be monitoring the situation on ground and we'll come to you when you have updates. We're hoping that this is something that would be halted even as you go around doing your activities to educate and sensitize the public.